Libby, Montana is located in the northwest corner of the state. We are surrounded by mountains and the Kootenai River and just amazing wilderness areas and national forest. And lots of fishing, hiking, hunting, and a population that really comes together to help each other. Started out as kind of a mining town, and it started out also with logging. So our high school mascot is still the loggers. So the vermiculite mine opened in about 1919. W.R. Grace bought it in the 60s, and that's when it became the biggest vermiculite mine in the world. The mine closed in 1990. So in those years between when W.R. Grace started it and when it closed is when there was a lot of just asbestos in the air because nobody knew that vermiculite was contaminated with asbestos.
Vermiculite was a flat-shaped crystal. It formed like mica. Through geologic time, it ended up crystallizing as a fibers. And this fibrous rock was hard not to mine along with the vermiculite.
In 1999, a reporter from the Seattle PI newspaper came to town, and he started researching it. So he found about 300 people who had died of respiratory disease. So after that, EPA came to look to see if it was real, the contamination, and so did CDC to see if there were health effects.
It's very common for individuals to experience airway disease, and they would be labeled as asthmatics, or if they had any cigarettes in their lives, would probably be called COPD. So why is this important? Well, this material, this ore was exported to over 250 sites, closer to 300 perhaps, around North America. Radiologists are unfamiliar with the appearance of this type of fibrosis. So it's created a real problem in recognition. We developed CARD in the year 2000. Working with the local hospital, we decided to set up the clinic to follow people after they had their screening. 25 to 27% of the population, or perhaps 1 in 4, had evidence suggesting they were experiencing asbestos-related disease.
What happened with our medical community, because we're so small, if you had a respiratory problem and needed to see a pulmonologist, you would get sent to Spokane or Kalispell. So it wasn't somebody in town that saw all this respiratory disease, so it didn't really get noticed.
That has been something that we continually try to address from our end, and being available to try to educate and outreach and help other people understand the differences and what to look for.
So CARD, the Center for Asbestos Related Disease, of course, we're a healthcare clinic, but we also do education and outreach and research and advocacy for our patients. So we are trying to be the central location for anything asbestos healthcare needs or related. Nobody else has a centralized clinic and a centralized place where everybody can go and find support. I mean, we have a social worker, we have nurses, we have doctors, we have respiratory therapists. We have a whole team of people that are just here to help. A lot of the problem in Libby has been with people not wanting to come here because they don't understand this and they're afraid. So one of the things that the whole community and CARD are trying to improve is people understanding that Libby is safe. It's been safe for many years now. You can drive through, you can walk through, you can come play, and nobody's gonna get hurt. It's gonna be safe.